Well, look at this. Obamacare premiums are dropping 4% for 2020. And you got to sign up soon because the open enrollment starts like November 1st to December 15th. That's like, what, 6 weeks? Man, so you got to think about it. So if you're renewing, you're starting the first time, and all the states have websites. And, with the down, 4%, some states are down like 12%. Yeah. So it depends on where you live, if you're going to pay more or not, or a few states went up, but very few. Overall, the whole, kit and caboodle, whatever it is shrinking by 4%, the average cost. And like the one they use as a benchmark is like a 27-year-old. Yeah. And their average premium now is in Wyoming at $723. But in New Mexico, it's only $283. So guys, that's like 500% difference or whatever it is. So it varies all over in the state you live in. And that's what I want to show you is that there are other options like that. But in applying for health care, the best place is to go is to the Obamacare website, which is not Obamacare, it's healthcare.gov. And you get all the free help there. Because otherwise, if you just go and Google, like, apply for Obamacare, okay, what are you going to get? Okay, here's what I did. Like, apply for Obamacare. And here's what you get. You get 3 million and 3.5 million websites. Okay, the first one is not Obamacare. It's some organization. Now it's a .org, so maybe it's okay, but they're advertising. I doubt. I didn't look in the specifics, so you don't want that because that's not the mother lode. Yeah. Okay. Now here's another one. .com. ObamacarePlans.com. That's not Obamacare either. That's somebody. Insurance companies are trying to get your money. Now they're hooked up eventually to Obamacare, but you want to go to the actual website, which is Obamacare. And here's another, Maryland healthcare plans. Well, that's probably, that could be part of it. And okay, but here's another one, .com, healthplanrate.com. No, you don't want to go there. You want to go to the horse's mouth first. If you're not happy there, then you got to fish around the other things. But somebody's going to pay for that stuff, and it's going to be you. So you go to the right place. So here it is, healthcare.gov. And that's what you want to do. It's a .gov website, so you want to stick with them. So like, okay, here's healthcare.gov. So you had 4 or 5 websites before you got to the one that you really want. Okay, now if you get to healthcare.gov and it's not going well for you for some reason, there's help. There's local help either on the phone. So you could say, hey, I need help applying for health insurance. But when you're on healthcare.gov. So don't go, clicking outside at healthcare.gov. You want to stay there, and you'll find this place getting help with insurance because they're getting grants to help you figure out the system and what's good for you. There's people usually in your community to go see or work with on the phone or whatever. They have a marketplace call center that could help you. So it depends on where you live because the computer picks up where you live and works with it there. So it's important to know that. And also what's important to know is that if you can't even afford these programs, and instead of going without any health insurance, or even when you pay these programs, you may have a big deductible and stuff like that. So you may still be paying out of pocket $10,000 or whatever, depending on what your conditions are. And there's other free programs at the local level. So here's a sample in Florida. What I do, I have a free report. If you're a member of Lesko Help, I'll send you a free report for your state. So you could see all the free programs that are available in your state because they're still there. With healthcare or not, programs, you have healthcare, you don't have healthcare, whatever, you could still use the stuff that's free. So remember that. Now here, let me go through some of the list here. Here, like free prescription drugs. Actually use this anywhere. So because a lot of programs aren't paying for it all. Okay, pparx.org. Okay, that's one. Go there, find out about that prescription drug program. Now, also every state, now here I have a video of a woman who uses it, and she gets an extra $300 a month for prescription drugs. Now here, see, every state has prescription drug programs. So see what your state has for prescription drug programs. And sometimes even your county has that. So you want to check your state and your county. And that's what we do. We put in all the programs here and the other health programs that are free transportation for emergency medical care. Yeah, that kind of thing. So you have free transportation, free health and dental care when you have no insurance. Okay, what do you do if you really don't have? Okay, the place I show you here is show you how to find your local office to do that. Because there's clinics around, and the county has clinics, and even and they're for free or for sliding scales. So call your local county, and I show you how to do that in here. And also hospitals have to pay. Certain hospitals do. So you can find out about what those hospitals are that already got grants to pay. But see, they don't have signs. These are all businesses nowadays, these hospitals. Everybody's trying to make money out of it because we spend more money on healthcare in this country than anywhere else in the world. So you have to know about the program that, hey, I think I'm eligible for this program at the hospital and get out of that care. Okay, here, what is this here? Don't pay for hospital care. Yeah, we talked about that. Health care coverage for Medicaid. Oh, see, that's another thing. If you want to know, you could go to healthcare.gov and sign up for Medicaid any time of year. So the enrollment for Obamacare, that means, well, that's in Medicaid people too, but if you haven't signed up for Medicaid, you could do that now. So it's not November 1st yet. So you could go right to Obama, see if you're eligible for Medicaid in your state. That will tell you on Obamacare. Okay, free services is a healthcare just for immigrants and refugees. A lot of them aren't using it. It's too bad. Free help for women, pregnant women. That's a free health care by the best doctors in the world. That's right. See, doctors get grants to treat conditions. You have, they may be studying, your diabetes or chronic pain or something like that, and find the doctors that are getting grants to treat you for free. Yeah. And here, over 800 affordable healthcare services for Florida uninsured. So that's it. See, and that's why you don't know about it. You say, oh, I can't pay Obamacare or whatever, and then I go without insurance. No, there's probably an option. It's going to take you some work to find it. Everything takes effort, and you have to start digging. And that's what I do, is show people how to dig this out, because it's not going to come to you. People giving away things for free or whatever, they don't come and knock on your door unless they want to get money from you. The people want to get money from you are the people who come and knock on your door. The people are giving away for free, they can't afford to do that, okay? Here's another 600 low-cost clinics in Florida. So that's 800 there, 600 there. Free condoms and STD provision. You worry about a sexually transmitted disease, you can call your county and get tested for free and even get free condoms too. So nothing does happen. So they're the kind of things that are available. Let's see, where else we got? Oh, we got lots here. Oh, STD, Holland, breast cancer, breast and cervical cancer. If you're a woman and don't have a lot of money or whatever, I don't think of $40,000, $50,000, you get free breast and cervical cancer testing and treatment. And that's at the county level again, too. So go to your county and find out about that. Now here, for alcohol and drug abuse, okay, we have a lot of problems with people with drug abuse, opioids and all that kind of stuff. Your county, or go to 211 and show you about nonprofits and things like that that will solve and help you work on that problem for free. So make sure you know that. Free immunizations. Also, I mean, all the stuff that's out there. Contact your county healthcare. Eliminate lead paint in your home. That's serious stuff. So you got to find out. One-on-one counseling for seniors and health insurance. Okay, this is important. If you're a senior, wonder about Obamacare or any kind of health insurance, what they have is a SHIP program, SHIP, and that's everywhere. If you go to SHIP, SHIP, TACENTER, so that's SHIP and then tacenter.org. Find your local office, and they will help you find free consultants that help you choose that. See, if you're going on the internet and looking for information and consultant help, you're going to get people who want to get money from you because they know how to use Google. They know how to get your attention and make sure you see them before you see the free ones. And they're going to be prettier and sparklier and everything to make sure that they get your money before you find the free one. Area of Office on Aging, it's a good place for seniors too, and that's in every county. In America, handicap ban, helpful. More free resources for patients, cancer patients. Now look at it. Now here is a listing of sources that I put in these reports that I give out for free to members. And this shows you all the free sources of money for people who are patients of one kind. Cancer patients, there's one for eye patients, get a free eye surgery, free glasses, stuff like that. So there's a lot of organizations that give out stuff for free, money and help while you're recovering from anything. Here's an organization that helps you with copay. You can't pay your copays. I mean, that's what's a killer now too. So these are copay. Also, this organization fights for you on your because you weren't charged right, or you charged too much, or you can't pay the bill, things like that. Grants for individuals with disabilities, like that. Now, dental care is the same way. Lots of free help with dental care. You got to find it. It doesn't come out and talk to you because these dentists have to pay for their degree, and they owe hundreds of thousands of dollars. So I show you where the free dental care is where you live. And I'm getting wonderful stories back from people who got a whole lot of dental care. And the one story I got back, he was, found out through me, went there, and he said, tell other people about it, because a lot of people aren't using this. We need more patients. That's incredible. Because dental care is the price of dental care, I think, is going higher than all the other healthcare prices, and probably any other price. Free 2-day clinics are all over. And here, even pet vets, veterinarian, your pet care is getting outrageous. And there's free help for pet cares too, how to get your pets treated for free. And then how to use crowdfunding also to solve that problem. So that's what I do on that. If you remember Lesko Help, I send you things like that, and just for your state, because I'm trying to get people to have the links that Google doesn't show you, because none of the links that I give you charge you any money. And you should be aware of that, because we live in a country that there are those opportunities, but it takes work. And the people who are getting money from you are a lot smarter on finding you than we are finding these free ones. So we all need help to find these free things, and particularly with healthcare. So Obamacare is going to be in the news because, number one, the rates are going down. And number two, it's the open enrollment. So if you don't have coverage, figure it out again this year, see what's available, because there's still grants of up to 400% of the poverty rate. That means up to like $90,000 you will get. If your income is up to like $90,000, you still get a subsidy to pay for your health care. Depends on size of family and all that kind of stuff, but that's the income requirement, up to $90,000. So if you're over $90,000, there's probably not a subsidy for you. If you're under $90,000, then you got a good chance of having a subsidy. So make sure it's from November 1st to December 15th. That's not very long, and then you're screwed until next year, unless you could always go onto healthcare.gov and see if you're eligible for completely free health insurance, and that's Medicaid, and you could apply for that year-round. If I'm wrong, let me know, but it's usually always that way. Okay. Okay. Thanks for listening. Those are members. Tell me what state you're in, and I'll send you all these links for your state. So you have a report for your state. Any friends, family needs health care, can't afford it. They have health coverage and they can't afford the copays or the deposits or all this kind of stuff. Try these sources, because these are options for you. But you gotta know to be able to go and take care of them, or take advantage of them. That's what I meant.